Hi, I'm Dr. Malpani. I'm an IVF specialist, and today I'm going to talk about a very common distressing problem called vaginismus. I'm going to go through some of the basics for you, and the good thing is you can always watch the video multiple times in case I'm going too fast or you need to review stuff. But vaginismus is one of those problems which no one talks about, which sadly most doctors are clueless about, most gynecologists don't know how to treat. And while vaginismus will not cause infertility directly, it does cause childlessness, because what it means is that the husband cannot deposit the sperms in the vagina, as a result of which the wife can't get pregnant. So back to some basics. This is what a woman's female reproductive tract looks like. That's the vagina, where every month she gets a menstrual period. There's a uterus and a fallopian tube. We don't need to worry about this right now. So when a couple has sex, the husband has an erect penis because he's sexually aroused, and then he puts that erect penis inside the vagina, and then he ejaculates. So he deposits the semen containing the sperms in the vagina, and the sperms then swim up, find their way through the uterine cavity, through the fallopian tube, the egg fertilizes, you get an embryo which then implants, and then you have a baby. So when does it happen that the woman does not allow the husband to have penetrative sex, will not allow the husband to insert his erect penis inside the vagina? And this condition is called vaginismus. It's not a commonly discussed condition because it's not something which people talk about too much. And as the word suggests, vaginismus means an involuntary spasm of the vagina. And because the vaginal muscles are so strong, it's the perivaginal muscles to be technically accurate, are so strong, that effectively once the woman is scared and worried for whatever reason, she will not allow her husband to penetrate. And I'm going to explain this to you in a little more detail here. During normal sexual intercourse, I'm just using this as a mannequin, what would happen is, these are the thighs, and the husband would be able to put the penis in between the thighs into the vagina, and they would be able to have intercourse. Now, typically that's not a problem at all, but for some reason, sometimes some women are so scared that they will not allow the husband to do this. Especially common in India, where people don't talk about sexual education, where a lot of things, oh, that's a dirty thing, you'll automatically figure it out, or a lot of the information is actually the wrong information, or disinformation, or misinformation, because they'll often get this on pornographic websites, which obviously are full of all kinds of rubbish, or they will ask, or they don't even know whom to ask, or they'll whisper amongst their friends, what happens when the first time you have sex? Does it hurt? Is it meant to hurt? Are you meant to bleed? Is there a hymen? Is it painful? All kinds of questions, and they don't know where to get reliable information from. So that if for some reason this is the first time the woman, and a lot of them are virgins when they get married, has never had sex before, and the man is often a virgin, he's never had sex before, so it's a bit like the lame leading the blind, and neither knows what to do. Now the man gets aroused fairly quickly, gets an erection, now wants to put it inside. And this may sound funny to you, but trust me, there have been so many times where the man has actually ended up putting the penis in between the thighs and ejaculating, and they think they've been having sex. That's actually not sexual intercourse, but they don't know any better because there's no one to guide them and no one to tell them, and no doctor comes to your bedroom to show you how to have intercourse. And in fact, there have been cases where actually the penis has been put in the rectum instead of the vagina, and that's the reason they've been childless, but neither of them possibly knew. So back again, when the woman has no problem at all, her thighs will automatically separate, she'll allow the penis to go into the vagina. But if the woman is scared, she's nervous, she's worried, she will clamp her thighs together. And because she's clamped her thighs together, and her husband loves her and he doesn't want to rape her, he will not try to push them apart, as a result of which he'll get frustrated. He'll either lose his erection or he'll just ejaculate outside. But imagine the amount of pain and emotional distress this causes, both for the wife and the husband. The wife feels absolutely incompetent. She feels, I'm a useless woman. I can't even allow my husband to have sex with me. The husband is worried. What am I doing wrong? Why doesn't my wife want to have sex with me? Doesn't she find me sexually attractive? Or is she a lesbian? Or is there something wrong with her? And because they don't know whom to talk to, and because they don't even know the technical word vaginismus, they don't know how to find this information at all. And that's the big problem. The good news is, if you come to www.drmalpani.com, there's lots of information on vaginismus. But part of the problem with vaginismus is not only do patients don't know anything about it, lots of doctors are extremely clueless. So in the past, doctors would actually be cruel. They would tell the patient, they would push a finger inside the vagina while doing a clinical examination. They would push 2 fingers, and when the woman would scream with pain and say, "No doctor, don't, that hurts," they'd say, "Shut up, you're a woman, you've got to be able to do this. How can you not allow me to put a finger? You're not cooperative, go away, leave the clinic." And they'd actually scream at the poor woman for not allowing them to do a clinical examination when the woman was so petrified, she felt she was being raped. And that's the reason she couldn't allow the gynecologist to do the examination. And once you had one bad interaction with a bad, unempathetic, unsympathetic, clueless gynecologist who forces her finger inside your vagina, you're obviously never going to go to another doctor because you're so scared. It's been such a terrible experience. And even worse, some of these gynecologists will say cruel things like, "Oh, her vagina is too tight. It's too tight and we'll open it up." And then obviously gynecologists are surgeons, so they love cutting stuff open. And they've got these crude procedures. In the past, there was a procedure, you'd actually cut it open to increase the size of it. Useless procedure. Would actually make things worse because you're creating a scar. And as I told you, the problem is never in the vagina. You must understand, the vagina is just a potential passage. The vagina is just a canal. It's the vaginal muscles, and every woman's vagina is stretchable. It's elastic enough to allow a baby's head to come through at the time of delivery. Now, if the vagina is stretchable enough to allow a baby's head to come through, trust me, no man's penis is so big that it's not going to be able to go inside the vagina. But because she's scared, she's not allowing the penis to go inside, which means she needs to learn how to relax her vaginal muscles, which is easier said than done, because she's not doing this voluntarily. She's not forcing the spasm. She can't allow herself to relax. So the problem again is not in the vagina. The problem is in the brain. The problem is in the mind. Now, if the problem was in the vagina, that would be easy to fix. You would do the surgery, you would do the operation, you would fix the problem. Easy to fix broken bones. Not easy to fix a mind, not easy to fix a brain. And this is where the problem is. So these patients require a lot of counseling, an empathetic, kind doctor, not someone who forces anything on them. And some doctors will actually tell them to use things like dilators, which are metal sets and test tubes, all of which is really rubbish. The best dilator is a finger, and the best dilator is the woman's own finger. So we actually need to tell her, be patient, this is going to take some time to resolve. First, use your own fingers to entry into your own vagina. You can use a lot of lubrication. You can use local anesthetics. You can then insert one own finger. You can increase that to 2. Once you're comfortable with putting your own finger inside the vagina, then you have a little more confidence. Then you can allow your husband to put his finger. All this takes time. There are no shortcuts. But once you're confident that can happen, only then can you start considering the possibility of allowing the penis to go inside the vagina. Bottom line is, it's a solvable problem. That's the good news. But solving the problem is going to take time because it's a psychological, emotional, mental problem. But if you're willing to be patient, we can provide you with a solution. Very rarely, for some patients where all these simple solutions don't work, we actually have another solution, which is non-surgical, where we inject what is called Botox inside the perivaginal muscles to actually paralyze these muscles. Just like Botox is injected in the face to remove the wrinkles because it paralyzes the facial muscles, you can do that in the vagina as well, and that works extremely effectively. If you want to find out more, do your homework before going to your doctor if you suspect you have pain during intercourse or you have vaginismus, because these are difficult problems and you need to be well informed. And if you end up with the wrong gynecologist, it's going to make your life a living hell. Please go to www.drmalpani.com. We've got lots more information on painful sex and vaginismus, and the better informed you are, the better you'll be able to solve your problem for yourself. And if we can help you solve your problem through information therapy, nothing is going to give me more pleasure, because that's the reason I became an IVF specialist, to help couples like you to complete their families and have a baby. See you.